I'm Dr. Keon West of the Institute of Psychological Sciences at the University of Leeds. Today I'm going to talk to you about a single paper that encompasses two studies. It's by Rosenhan in 1973. It's called On Being Sane in Insane Places and was published in the journal Science. To understand the importance of this study, you have to ask yourself a question. Can you tell the crazy from the sane? Are you able to distinguish between the behaviors of those who are mentally insane and those who are still mentally sound? This question is not a silly question, and it's not in itself an insane one. However much we may be convinced that we can tell crazy people from sane people, the evidence actually doesn't bear that out. And if you follow me through the story of this study, I'll explain to you how. An equally important, if not more important question is, can psychiatric professionals tell the difference between the crazy and the sane? Again, incredibly important, but this study bears out that actually telling the difference between crazy people and sane people is not that simple. It argues for abandoning in many important ways the labels that we give to the crazy and the sane, and it shows that in many ways the difference between somebody acting crazy and someone acting sane can be attributed to environment as much as any variables about the person. But before we get ahead of ourselves, let's explain how Rosenhan tested that idea. To test whether or not psychiatric professionals could tell the difference between the crazy and the sane, Rosenhan himself and 11 other people, so that's 12 people in total, presented themselves as pseudo-patients to various psychiatric facilities. The 12 pseudo-patients had very specific instructions. They were supposed to go and present themselves to the psychiatric facility and to complain of hearing voices in their heads. These voices were supposed to be of the same sex and generally indistinct, difficult to make out, but they were told to specifically say that the voices said three things. They said hollow, said empty, and they said thud. That's it. Everything else was supposed to be 100% accurate. Not their names, of course. They didn't want to give their real names, lest these diagnoses embarrass them later in life. But apart from their names, and in some cases their vocations, because they didn't want to say they were psychiatrists or psychologists, as that might tip people off, everything else was true. They gave real histories about their relationships with their mothers and fathers. They gave real stories about the friends that they had. They gave real stories about their experiences, their emotional highs and lows. And all this was taken into account with their diagnosis. And then there was one other thing. Once you were inside, assuming you got inside the mental facility, the only way out was by convincing the people who worked there that you were sane. There was no other way out. So you had to behave in a sane way after saying this in order to be convincingly sane enough to get back out to the mental health facility. I wish I could tell you that it was really exciting and that one of them is still trapped in there now, but that's not the case. It's a lot less exciting than that, but it's still very interesting. The first interesting thing is that all 12 pseudo-patients were accepted as insane. And even despite giving their regular histories, their true stories of their lives, 11 of the 12 were given diagnoses of schizophrenia. One of them was given a diagnosis of manic depressive disorder with psychosis, albeit this person went to a slightly more upscale institution. Maybe that's why he got that diagnosis and not schizophrenia. And they were all admitted to the hospitals, and the hospital stays ranged between 7 and 53 days. Think about that for a bit. 53 days is a long time. That's almost 2 months. The average stay was about 19 days, and that's 3 weeks. 3 weeks before anyone noticed that these people were perfectly sane. Well, not anyone. That's not entirely true. Some of the inmates were suspicious of the psychologists and the other people who were pretending to be insane in the institution. They'd come to them and say, "You're not really crazy. You're a journalist, you're some kind of news person, you're working for the media." But none of the nurses, none of the doctors ever noticed that any of the pseudo-patients were anything other than regular patients. When they were released, all 12 pseudo-patients were released with the diagnosis of schizophrenia in remission. And what this meant was that none of the doctors or nurses could perceive of anyone actually being cured of schizophrenia. Once you have schizophrenia, you have it for life. You are in remission with the expectation that you will start to act crazy again at some point. At no point can you say that this is something you put behind you. The conclusion that Rosenhan drew from this was that even trained medical staff cannot tell the sane from the insane. Rosenhan's study did have its critics, most of whom pointed out that yes, these pseudo-patients were all admitted to hospitals as having some kind of mental disorder, but they gave false symptoms. Remember that they were told to say that they were hearing voices, and that these voices were saying hollow, empty, and thud. And one psychiatrist pointed out that if you were to go to an emergency room vomiting fake blood, and the doctors diagnosed you as having an ulcer, then it wouldn't be fair to say that the doctors were being incompetent, that you were displaying fake symptoms, so you got a fake diagnosis. Rosenhan agreed. But then he pointed out that if these doctors were to keep you for 53 days having that same illness when you clearly had no symptoms of it, then you could say something very different. And at that point, no one disagreed. And you ask yourself, how can this happen? Surely trained medical staff are trained. That's what's implied by the title. So they should be able to tell the sane from the insane. How could they make such an incredibly large error? To understand that, you need to understand the importance of context. That's two very important considerations. One is that once someone is considered insane, all their behaviors are interpreted in the light of this particular insanity. And the other thing is that a mental health institution is a place that can make you act like you're insane, even if you're not. I'll give you some very specific examples of what that means. One of these pseudo-patients who was in this situation found himself pacing the corridors, up and down. One of the nurses, a kindly nurse who was trying to do well, asked him, "Are you anxious, Mr. X?" Mr. X, of course, because we're not using his real name. And he replied, "No, I'm simply bored," because it's boring in a mental health institution. But the nurse thought of the anxiety that he might be feeling rather than the boredom. In another example, a patient would go berserk because of the treatment of another inmate or of even a member of the staff. They'd do something disrespectful or something mean, and then they would get angry. And when another nurse approached the situation, they would never ask what happened. There was no accounting for the incident that led up to this particular outburst. It was always assumed that the outburst was because of the psychopathy of the person, him or herself. And that's very important. Everything you do is then interpreted as being crazy. Another interesting note is that all the pseudo-patients were instructed to take notes, and at first they used to hide the notes because they didn't want anyone to become suspicious, even though some of the inmates did eventually become suspicious. But throughout this study, none of the nursing staff ever became suspicious of what they were doing. Some of the nurses would write notes like, "patient engaging in writing behavior," again assuming that the writing was just part of being crazy, and that everything that they did was just another sign of their psychopathy. And then there are examples of ways in which being in a mental health institution can make you act crazy, even if you're not crazy. One example was very stark. It was a nurse who unbuttoned her blouse to adjust her brassiere in front of a room full of male inmates. The pseudo-patient said he didn't have the impression that she was trying to be sexy or seductive, that in her mind she simply didn't count the patients as being there. They weren't actually people and they weren't treated as such. And this would be reflected in other ways as well. Sometimes the nurses would congregate and they would speak about a patient within earshot of the patient, and they'd say very clear things about them as if they weren't around. This kind of depersonalization would make the patients act out, as it would make anyone act out. The other way in which being in a mental health institution can make you act crazy is that doing perfectly normal things often doesn't result in very normal responses. So the patients would ask nurses or doctors or any member of the staff questions like, "Excuse me, when can I have grounds privileges?" Or "When can I go outside? When can I have this or that kind of privilege in the institution?" And they'd often get very strange responses, like one doctor who would say, "Oh, hello, Dave. How are you this morning?" and then simply walk along without answering the question. If you do this to someone for 3 weeks, they will start to act a bit strange. And many of the pseudo-patients did start to act a bit strange. Now, all the nurses reported that the pseudo-patients were very cooperative and very decent, which of course they had to be. They knew that good behavior was their only way out of the institution. But at the same time, they tried all sorts of things. One pseudo-patient tried to engage in a romance with a nurse just to feel like a person and not like a nameless inmate in the institution. When the results of this first study came out, members of the psychiatric community reacted very strongly. Many of them said this kind of thing might have happened at those other hospitals, but it could not possibly happen at our hospital. Rosenhan took up one particularly prestigious hospital on this challenge and told them that in the period of the next 3 months, he will send one or more pseudo-patient to their facility, and he would see whether or not they were capable of picking out the pseudo-patients from the real patients. Over the course of 3 months, 193 patients presented themselves to the facility. Of this 193, 41 of them were strongly suspected by a doctor or some other member of staff or both of being a pseudo-patient. Another 42 were somewhat suspected, though not as strongly, of being pseudo-patients. That's almost half of the people who were there. In reality, Rosenhan had done no such thing. He'd simply told them that he'd send a pseudo-patient. He didn't actually send anyone. And that's a huge error. Errors on both sides, where 12 perfectly sane people can be called crazy, and almost half of 200 people can be called sane. That shows that there is something fundamentally wrong with the diagnostic procedures that we use to say whether or not someone is crazy or is sane. There's something worth talking about in terms of the stakes and why these two mistakes were made in the directions that they were. It's not that people who work in psychiatric facilities are incompetent, but it's that they're motivated to do one thing versus another. You don't want to tell someone that they're okay if they're not okay if you're working in a psychiatric hospital. You're more willing to take the error that you accidentally take a sane person and put them in than that you accidentally leave someone who actually needs your help on the outside. What Rosenhan did in the second study was shift the stakes. Now their prestige was on the line, and if they didn't recognize the pseudo-patients, suddenly they'd look bad. Then they were much more willing to make that kind of error, and so they heavily assumed that people who were actually in need of help were pseudo-patients. What this does say, though, is that we need to be very careful about the kind of errors we make, and we need to be aware that we make errors on either side, because we do. So what can we take from these two studies? Rosenhan is not saying that there is no such thing as real mental disorder. We're not going down that road at all. No one believes that. No one believed it then. No one believes it now. Psychological suffering exists. Anxiety exists. Depression exists. Hallucinations, both auditory and visual, exist. And body image disorders exist. And these things cause genuine psychological suffering to the people who have them. What we should be very careful of is the willful stripping of social rights of the people who we label as insane. Think about it. If someone has a cold, we don't label them as a cold. But if someone has schizophrenia, they become a schizophrenic. And if someone has almost any kind of disease, appendicitis, gastroenteritis, even cancer, they can get over this. We don't assume that they are for the rest of their lives suffering from appendicitis in remission. But we do for mental health disorders. And this is something very important and something we should consider when we're looking at how we treat people who have at some point suffered from one or many mental health disorders. One last thing I'd like to talk about is the blurring of the categories of the sane and the insane. I've been using that language throughout the podcast, and many people who have mental health difficulties might find that language offensive, and reasonably so. Right now, it's safer to talk about the actual psychological suffering that people have than whether or not we should label someone crazy or insane. In fact, many studies are coming out now that show that the line between people we call sane and people we call insane is very, very blurred. One study in particular showed that many healthy people who don't have any psychosis-related mental disorder actually experience more hallucinations than some people who do have a psychosis-related disorder. Remember that it's not a clear-cut thing, and if you're thinking of yourself as not one of them, be very careful. We all at some point act out for no reason, have emotional outbursts that we can't explain, talk to ourselves when we're walking down the corridors, or feel anxious or depressed. Whether this becomes an excuse to globally define someone as someone with a mental health illness or mental health disorder, and then label them as a social other, is something that we should think about very carefully and discuss very carefully before we do it. And with that, you know the story of Rosenhan 1973 on being sane in insane places. I'm Dr. Keon West from the Institute of Psychological Sciences at the University of Leeds.